Good afternoon, teacher.
Hi, good afternoon, Liz. How are you?
Pretty good, teacher. And you?
Fine, thank you. I'm pretty good now. Not too much to work to do, so I'm good.
That's good, that's good.
Yeah. So, how's the weather today?
It's okay. Not too much windy, a little bit raining, and a little bit sunny.
Okay, so it's a mix.
Yes.
Okay, let's wait a minute for our friend Salome.
And
Her
how
little
is COVID?
to make it. I'm sorry?
How is COVID in your country?
Well, yesterday it told us that I don't know, but maybe an area will be closed. Uh,
Again?
yeah, but not. We're not gonna get into quarantine yet. I'm
Uh-huh.
not sure, but an area will be closed. So I don't know. What about you? How's your country?
Mm, it's the same. It's almost the same. I think for Christmas and uh end year uh are gonna apply more rules, and maybe we have to stay in home more hours, like ese toque de queda.
Uh huh. Yeah.
Yeah, but just only for the holidays. Then I think is the same. But I heard that in Germany
Mm-hmm.
the rules come stronger. Maybe I don't know if they are in quarantine, but they have more restrictions now.
Oh, yeah. I think we're gonna go by this that way, right? We cannot avoid that, so we have to
Yes.
prepare just that.
Yes.
And what about the cases? Are they adding more or not?
It's the same it's still equal. The hospitals are full, but the people don't care. Only I think only the people worry when they lose someone closer. Um, I don't know, but the COVID, if the COVID continue, uh, I think it will be a very difficult to put all the people again in house.
It will be really difficult, right? I think that, but maybe we don't understand the grade of all this, and I think it will be so difficult. Hi,
Yes.
Salome. Good afternoon.
Hi, Salome.
Good afternoon, teacher. Hi, guys.
Hi.
Hi. Okay, I was asking Liz how was her country? How was your city? You live in another city, right?
Yes, I am a Quito. And in the morning rain a little bit, but now is cloudy without rain, and that's good.
Oh, it's almost the same, I think. In where is Lisette now? I
Yes,
don't know.
in
Maybe
Cuenca.
I totally forgot the name of the city. You,
No worry.
Salome, are in Quito,
Yes,
and you are Liz in. Mm,
Starts with C.
yeah, I know. I was telling yesterday to a friend. Um, ah, I
And then
forgot.
you, and then it.
hey.
I forgot. Tell me,
It's
please.
Cuenca.
Cuenca, yeah. I'm so sorry.
Don't worry, I don't remember your city too. So, what is your city, teacher?
La Paz. La
La
Paz.
Paz, La Paz, yes.
Yeah. Okay, we are even then.
Yes.
Okay. And what about COVID cases, Salome?
He is. I don't listen the highest of the case, but I was talking with my friend that work at La Tacunga, is other city, and they
Mhm.
are incrementing the cases very fastly.
Uh-oh.
So that is dangerous, I think, and I don't know why in La Tacunga and not here. Maybe here are not saying the truth about the case. I think so.
Yeah, I heard the first time we heard about COVID, I heard that Quito was the worst place with this problem. People were dying on the streets, and it was so crazy there. I don't know if it was real or just the TV programs were scaring us.
I think that's real. That we were collapsed in one
Hmm.
moment of the pandemic.
Wow. So we have to be careful.
Gee.
Yeah.
Yeah.
People didn't understand here the first time until they don't have where to go. Or I refer to an hospital or clinics or something like that. And then it was almost the same. They cried, this, they were desperate, but after that, they still go out without a mask, without an alcohol. I don't know. They are crazy.
Yeah.
Yes, it's pretty funny because I have seen that people are using masks.
Mhm.
You say like, "Oh, what responsible person! It's good," and then they go to the restaurant and put out the mask and eat with more people around, and then go out to the restaurant and they put again the mask, and I am like, I that's crazy because it's like the people think that they don't gonna get infectious when they eat with more people around.
Yeah, that's funny, right? I don't know what we're gonna do with our people. So, can you see my screen?
Yes, teacher.
Le-
Yes, teacher.
Okay, okay, let's start then. I will put this. Okay, today we're gonna talk about medical treatment, and we will start with prescriptions and drugs, that it will be the most common things. As part of treatment, a doctor may prescribe medication, commonly referred to as medicine or drugs. A prescription may take these forms. And I don't know, I cannot understand the the writing. Can you?
Yes,
Nabumet.
it's stuff like tablets,
Okay, nabumetan.
nebumetan, 50 milligrams minute, 56.
Okay,
Sig, Sig, I don't know what is the meaning of Sig. Two tablets and no.
okay. So here in the left side, we have the old style, right? Maybe so much I like to doctor's handwriting. I don't know if it's your case, Liz, but here we have the new style. something more visible and easy to understand for a patient, because the only people who can read more recipes or prescriptions are pharmacists, right? or or at least they say that. What about you, Liz?
Well, my letter is not so bad. You can understand it.
It's legible then.
Yes, but now with the new rules or new laws, you have to be comprensiva,
Yeah,
letra comprensiva,
understanding,
understanding letter.
handwriting. Uh-huh.
Yes, because it is dangerous when you write wrong. Maybe the patient can understand and maybe took the drugs in
Wrong drugs.
the wrong way. Uh-huh. And or maybe the pharmacist maybe can understand and give another medication. So some doctors write really bad, but now the government is trying to take control more about that.
Okay, so it's almost the same for us as in the UK, because as we were watching, this is the old style, and illegible handwriting maybe, and this is the new style, the correct one. What about you, Salome? So I
Um,
think you can handwrite some instructions too.
yes, but I have a good letter because I become, how Liz said, comprehensive with the other people. I had an experience when I was in my internship in at hospital.
Mhm.
Is here is not allowed to use abbreviations
Ah,
specific with the millimeters cc centimeters cubic.
uh-huh.
And some doctor, but all doctor, uh, writing the prescriptions. I don't remember what, but was 20 cc
Okay.
uh, per 8 hours cada 8 hours. But that letter was so bad that it was confusing. It said this la C is
Like
like
an
a
oh,
zero.
yeah,
Aha, like oh, and that is so dangerous because maybe you can understand to hunger and administrate that. So here is not allow the abbreviations. So
yeah.
the
That's
doctor have to be uh, conscientious to write good, have a good letter.
yeah. It. mm, I remember in my internship into the university, uh, teachers told us to write down just with capital letters. I don't care if you have a beautiful letter, right handing, you have to write down on capital letters. That's what they told us. So we have learned and then just get used to it. But it was for a reason, and that's good, I think. Okay. So continue, please. Can you read, Liz?
Yes. In the UK, patients take prescriptions to a chemist which sells a wide range of non-prescription medicines and other products such as cosmetics. For dispensing by a pharmacist, the person who prepares the medicines. In hospitals, prescriptions are dispensed by the pharmacy.
I'm
H-E-I-A.
sorry. It was the
Ah,
D.
okay.
I'm so sorry.
Don't worry. The department where the drugs are prepared. Note: Latin abbreviations in prescriptions are being replaced by English, but may still be seen.
Okay. So in our countries we have the pharmacists, right? They give us what the doctors prescribe, or you have some other instructions there and another person gives you the drugs. Hello.
In our hospitals,
Oh,
we have pharmacists, but maybe when you are walking on the street and you see some pharmacies has the correct personnel, but another put another a common person and just sell. I don't think we have too much control on that.
yeah, that's right. I think a biochemist maybe is the one who attend these pharmacies.
Yes,
Yes, right?
biochemistry. That was yes.
Yeah. Okay. Salome, can you read this, please?
Sure. The British National Formulary provides information on prescribing and administering prescription drugs in the United Kingdom. Sulconazole nitrate. Indications: fungal skin infections, cautions, contact with eyes and mucous membranes should be avoided. Side effects: occasional local irritation and hypersensitivity reactions include mild burning sensation, erythema, and itching. Also blistering. Treatment should be discontinued if these are severe. Dose: apply 1 to 2 times daily, continuing for 2 3 weeks after lesions have healed. Exelderm, Centrafarm, and Quim. Sulconazole nitrate 1%.
Okay, thank you. So I think in your areas you have to work with a lot of kinds of drugs or medications or pills. Is that right?
Yes.
Yes.
Is there any, I don't know, maybe little pages or a book or something you have to go with in order to remember the whole kinds of medications?
We have like a guide. It goes PLM.
Mm-hmm.
It's a kind of guide that we have all the medications, and also we use the Stanford Guides. Is a little book that has all medication and only with the quantity that you have to administrate. Depends of the illness.
Okay. And I don't know if there is the same, but here at public hospitals, they have a restriction with drugs, right? Just the simple ones and the cheaper.
Yes, the public centers have their own medications, and you can definitely can't prescribe commercial medication.
Okay. Not even if a patient asks, maybe,
No,
okay, I will do what you're telling me, but if I need something hard or something better, you can tell me and I will buy it. Not even that.
the patients say that, and maybe if you want to help, you can do it, but you have to be very careful because if someone that uh, are if someone are control that, or maybe some personnel that works in government find that, you will have problems.
Oh, well, so bad. or both? Okay. Okay. Here, first one, can you read the first paragraph, Salome, please, and the second, Liz?
Sure. An indication is a situation or a sick that suggests a specific treatment should be given. A contraindication is a situation or sick that a specific drug or treatment should not be used or is contraindicated.
Exelderm is a proprietary commercial name for a medication containing sulconazole nitrate. The same drug may have both a proprietary name and a generic name. For example, Prozac and fluoxetine are the proprietary and generic names for the same drug.
Okay. So, in your experience, which one is the drug with the most contraindicated, I don't know, or which one is the one you don't give to your patients? The one who has a lot of contraindications and still
I
give them
think
at
amphotericin.
hospitals. I'm sorry.
Amphotericin. Try
Okay,
to not use that.
continue.
We try to not use that because, especially in pregnancy, because the fetus can have some malformations.
Okay, and in which cases we use amphotericina? Amphotericin B?
How should be in English?
I think it's amphotericin B. Oh, let me. Yeah, amphotericin. It's with C-I-N-E.
Okay, amphotericin. We use, it's like an antibiotic and an antifungi.
Yeah,
So we use, for example, in a common case that is called candidiasis.
okay.
Several candidiasis. And I remember a case that the name was, let me see, aspergillosis.
Is the name of a condition?
Yes, this is a condition. And the third cause that I have seen that use that medication is when the patient have leishmaniasis.
Okay. That is very, very rare
Yes.
in city, or you have a lot of cases.
In rural area, you can find more, but in city, it's very rare.
Yeah. And in your experience, Salome?
I think the same at least, but I know about the basic pharmas of the disease because I don't prescribe
Mhm.
the
Yeah.
medicaments. So I in the most medicament that I maybe sometimes I'm very afraid to do something wrong is about the sulfato de magnesio. We use this in a pregnant woman that have problems with high pressure blood.
Okay.
So that is the medicament that I sometimes is really I have to be really careful about this medicament.
And we know why, because of the baby, right?
Yes, could be, but it's not for the baby exactly because it could be for the baby, but more is for this medicament affect the nervous system.
Mhm.
We have to be if the patient are not intoxicated with these medicaments because These medicaments have to be in infusion, administering continue.
Okay.
Uh-huh.
Okay, so this kind of drugs may not use for women
Mm-hmm.
when they are pregnant, especially.
Uh, yeah, we use this medicament and a pregnant, specific in a pregnant persons, a pregnant woman.
Okay, thank you.
Welcome, teacher.
And we have the surgical treatment. Please, can you read this, please?
Sure, teacher. Surgical treatment. The operating theater. Surgery is carried out in an operating theater. Great care is taken to make sure that operations take place in sterile conditions, free from microorganisms. The surgeon and his or her assistant wash or scrub up and put on surgical gowns, mask and gloves. This is known as preparing the patient. They are then covered with sterile drops, so that only the area of the operation is exposed.
Okay, thank you. So, do you have any questions for vocabulary? Like surgical gowns? It's the dress that doctors put on for a surgical treatment.
The blue one,
Yeah,
uh,
the last one, las batas, like a dress.
Okay, teacher.
The other the other day, someone was asking me how how was the name of the batas, right?
Mm-hmm.
And they are surgical gowns. Okay, something else?
uh, drapes, sterile drapes,
Uh, those kind of things we use to uh, I don't know if you put some liquids on there, maybe alcohol, iodate alcohol, iodinated
just
alcohol.
at the beginning for cleaning the skin.
Yeah, and that are the drapes.
Ah,
Like, what are you thinking in Spanish? Can you tell me?
Solución estéril.
No, no, no. The other things. I forgot the name of the son torundas,
Ah,
but
drapes
I
are redondas.
cotton. Oh my
Ah,
God, I forgot the name of
okay,
the cotton. Okay, that is.
okay, thank you.
Anything else?
I think no, teacher.
I think no.
Okay. Okay, so we have here surgical instruments that at least maybe might be more interested in because
Yes.
okay, so what can you read it please, Salome?
Sure. Surgical instruments, retractor, artery forceps, scalpel, scissors, and dissecting forceps.
Right. So did you usually use these kind of tools?
Yes.
Okay, me too. Artery forceps, um, retractors too, but another kind of retractors. Yes, more or less that. Okay. And the operation. The operation begins when the surgeon makes an incision or cut. Control of bleeding is very important. A swab is a pad of cotton or other material used to soak up blood from the operation site. A sucker is a mechanical device which aspirates sucks up blood. Bleeding vessels are tied with ligatures or sealed by an electric current diathermy. Do you understand that term?
No.
Cauterizador.
Yeah,
Yes.
that's right. That's right. Drains may be inserted to carry away fluid which might act as a culture medium for bacteria. Various methods are used to close the wound. For example, sutures, also known as stitches, or staples. Finally, the wound is covered with a dressing. Okay, if you have another some questions about the vocabulary.
Sealed, limited one. In
Staple.
the 7th line.
Uh, okay, bleeding vessels are tied with ligatures or sealed. Sealed are like closed,
Okay.
sellados.
Okay. Thank you, teacher.
You're welcome.
And what about staples in the last line?
Staples. Okay,
Staples.
staples. Let me know. Are like these metallic structures you put into one side to another to close the wound. Do you understand?
Uh,
Like
like grab.
grapas?
Like grab. Like you did.
Right. Good. Very good.
Thank you.
Okay. What else?
No, I think no more.
Okay.
It's okay.
Okay, very good.
I have one. I found it.
Oh,
Sorry,
okay.
teacher.
No, it's
Soak
okay.
up.
So cup. Where is it?
Four in the
Swab
4th line.
is about other material used to soak up blood from the operation site. Okay, soak up, it's like when you use a thing to aspirate some liquid, maybe a cotton.
Okay.
Can you tell me in Spanish?
Es como secar o absorber.
Absorber.
Thank you, teacher.
Okay, you're welcome. Anything else?
No, sorry.
No, but that's good. It's better in that way we're gonna remember better. Okay, here, Liz, can you read this, please?
Yes, teacher. An operation report. This patient had an indirect right inguinal hernia. Anesthesia. Spinal anesthetic with local anesthetic infiltration. Incision. Right inguinal. Procedure. The external oblique aponeurosis was divided and the spermatic cord mobilized. The hernial sac was identified and separated from the spermatic cord. The hernial sac was then mobilized back to its neck, where it was transfixed and the redundant tissue excised. The fascia at the neck of the spermatic cord was divided, carefully preserving the vessels, the genital branch of the nerve, and the vas deferens. Thereafter, the posterior wall of the inguinal canal was repaired in 2 layers. Closure. The wound was closed in layers. with Dexon suture material to the external oblique aponeurosis and staples to the skin.
Okay, thank you very much. Do you have any questions for vocabulary?
Transfixed
Transfixed. Where is it?
says in
Mm,
procedure
oh,
in the third line.
okay, the hernial sac was then mobilized back to its neck where it was transfixed and the redundant tissue existed. Okay, it might be used as maybe paralyzed.
Yeah,
Yeah, it's like paralyzed. And the
okay.
redundant tissues exist. Do you know the meaning of exist?
No.
It's when you uh, take off, in this case, uh, tissue, like
Sacar, extirpar.
extirpar.
Okay, thank you.
Okay. And here is this word, fascia. And it's the same meaning in Spanish, but I don't understand. The fascia at the neck of this spermatic cord was divided. Maybe it refers to the superficial tissue of this element.
It's
Am I
like
right?
a recoverment.
Yeah. Okay, but it's the same in Spanish.
Yes.
Fascia. Okay. What else? Salome, maybe you have some questions?
Mm, I think not because I am listening all the list questions, so it's for me too.
Okay. Okay, that's good. Or, oh, and maybe Liz knows that the Dexon suture, it's a kind of suture do you usually use?
We use picril, nylon,
Yeah.
and yeah, that's the two more common.
Yeah, I know them. I don't know about Dexon. Maybe I don't know, for um, for more specific surgeries, maybe.
I think yes, because I'm looking Dexon on internet and it's like picril because it's uh, reabsorbible.
Yeah,
So I think it's like picril.
more intern, right?
Mm-hmm.
Okay, thank you. Okay, anything else?
I don't have more
I think
questions.
no, teacher.
Okay. Do you understand these words? The hernial sac?
Yes.
Yep,
Okay. Okay, very good. Then Salome, can you read this, please?
sure. Therapies. Radiotherapy and chemotherapy. Radiotherapy is the use of radiation in controlled doses to treat cancers. It works by damaging the DNA of malignant cells. Radiotherapy may be used as curative treatment, for example, to shrink tumors, as adjuvant treatment alongside for or following chemotherapy treatment with anti-cancer drugs in lower dose as palliative treatment to reduce pain and other symptoms of cancer or disease, but not as a cure. a radiologist determines the dose and the exact target for the radiation beams. Dosage is measured in grays, G, E, E. A daily dose is a fraction. Radiotherapy can also be delivered internally by radioactive implants such as needles or by liquids such as strontium for some bone cancer.
Okay, thank you very much. I know we talk more, we talk about this for 2 or 3 classes maybe, but it's important. I think there are some words here that you don't recognize, maybe. For example, to shrink tumors, it's like to make them little. Mm, yeah. Another word.
I have a question in the last part
Mhm.
when says a radiologist determines the dose and the exact target for the radiation beams. Beams in the traductor is vigas, so I don't understand the meaning in that context.
The radiation beams, if you use together these words, it means like rayos de radiación.
Ah, okay. Thank
Okay,
you.
I know. I was like, what? So, yeah, rayos de radiación.
I was imagining like the doctor was punched with a beam patient.
No, well, no, it's not. Okay. What else? Mm, 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 mm. Okay, I think this is much more for an specialist, right? But you already know. Okay, then here, can you please read?
Yes, teacher. A day in the life of a physiotherapist. Sam is a hospital physiotherapist, sorry. She works mainly with patients who have conditions or injuries affecting the lower extremities such as fractures, torn ligaments, and cartilage tears. Most of her patients are referrals from other departments in her hospital. She also works with patients in rehabilitation following orthopedic surgery. Some are young people with sports injuries, others are elderly people who have had hip replacements. Among her therapies are manipulation, massage, and exercise to keep the joints mobile and to strengthen the muscles. Rehabilitation some patients mean helping them to walk again using crutch or Zimmer frames.
Okay, thank you. As you can see on your left, you will find out that crutches are these tools that helps a lot. And a Zimmer frame is this one for our grandparents. Okay, I don't know if you have any questions here. And I have a question for you. Maybe, I don't know, but as you can rotate into the hospital, maybe went to this side of area, or you never work with a physiotherapist?
I never work with the physiotherapists until now.
Okay, and you, Liz?
No, we don't have that rotation. I only have the geriatry rotation, nothing more.
Okay, and you work with these tools?
No, no, we only try to stabilize the patient.
Oh,
I have to make curaciones.
yeah. Wait.
I don't remember the word. Cures. I had to make
Yeah.
cures. Uh-huh.
We forgot. We both, or the three of us, forgot about the easiest words in the world.
Yes, so we have to make some cures of very deep wounds,
Mhm.
and that's all.
Okay. Okay, and you have here any questions for vocabulary?
Torn. What is the meaning of torn? Torn ligament.
Where is it, please?
In the fourth line at the beginning.
Hmm. All right. As fractures, torn ligaments, like when you desgarro.
Ah,
Yeah,
okay.
is the meaning.
Thank you.
You're welcome. And cartilage tears. I know you don't understand that, or yes.
Cartilage tears.
Yeah.
Yeah, no. Tears is not lágrimas.
Yeah, it might be just the single word like beam in the last example, but
Uh-huh.
cartilage tears are like desgarro de cartílagos. So if you can write down that expression, it's important. No.
So for the same words, for the same meaning, we have different words. For example, para desgarro usamos torn y tears.
Yeah, I have a doubt here. Let me check. Torn, it's like break. It's like a synonym, okay?
Uh-huh.
And tear, cartilage, tears, both words means desgarro de cartílagos, okay?
Ah, okay. Thank you.
Okay, it's when like we have a doubt about lawyer, liar, and layers.
Yes.
Remember?
Yeah.
But it's like that. It's almost like that. There are many words that the if you use it alone means something, but if you use it with another word, it means another thing. So it's very interesting, but we have to be careful with that. Okay. Do you have any other questions here?
Elderly is like a synonym of oldest people.
Yeah,
Mhm.
something like that. It's almost the same.
Okay. I don't have more questions, teacher.
Okay. Did you injure sometimes and you have to use crutches. I'm not gonna say a Zimmer frame because I don't think so, but maybe crutches. Any one of you?
Mhm.
No, you didn't. You haven't used it.
No.
No.
Anyone in your family?
My mom, yes.
And it's helpful. I think.
Um,
I think. I don't know. They feel pain in other areas, right?
yes, in armpit.
But I think it's helpful. Or what do you say?
Well, I think it's helpful because she had a surgery of her leg. He
Mhm.
had a hip replacement.
Okay.
So while she was waiting to recover, she need to walk. So the crutches help her.
And maybe as a Zimmer frame too, or not.
I see. I don't know. I don't remember because I had I don't know maybe 4 years.
Wow. Okay. Okay. I understand. You were playing games. Okay. But I think it's really helpful too. Okay, let's change and talk about cognitive behavioral therapy. Salome, can you read this last one slide, please?
Sure, teacher. Cognitive behavioral therapy, or CBT, is one of the talking therapies for mental health conditions. It aims to eliminate negative thoughts and change behavior in response to these thoughts. It can help with anxiety, panic attacks, depressive disorders, post traumatic stress disorder, and chronic fatigue. Therapy can be effective. It is more effective than counseling for some and can provide long term protection against relapse, a return of symptoms after improvement. However, patients must be committed to solving their problems and prepared to work on them between sessions.
Okay, thank you very much. So, do you read here on the right side? It's like a circle, and we start with thoughts. What we think affects how we feel and act. Behaviors, what we do affects how we think and feel. And emotions, what we feel affects how we think and act. And that's all about the cognitive behavioral therapy. Do
Mhm.
you understand? Do you think it is helpful?
Yes, I think this is very helpful because, like I told you one time, I think it's more useful therapy than maybe only just give drugs and forget the problem.
Yeah, that's right. Imagine you can solve a patient's lives. Nowadays, people get anxious, depressed, and have panic attacks. I don't know if some somewhere before people talk about these things. I this is the first time I heard about this those few years, and I
Mhm.
feel it like anxiety, for example. I really feel it. And it's better if you talk about these topics with someone.
Yes, but I don't know because, like you said, and you're right. This is like a new therapy. For example, with kids, um, some people say that you have to talk with them
Mm-hmm.
or maybe go to therapy and not only uh, castigar, punishment, creo que es,
Punished. Uh-huh.
punish. But I don't know because I have a little bit doubts because I remember when I was child, if or adolescent or teenager, when I have a problem, my mom with one scream and I was like okay, and I don't take any therapy.
Yeah. uh, Nowadays it's much common to get into a therapy to your children, but I don't know if it's okay. Maybe it's most for moms, for the mother, than for the children, right?
Yes, or for example, in a teenager, for example, a teenager wants to suicide. My mom, I have a friend that she wants to do that, and my mom with one scream and a few words, she she hizo que reaccionara.
She made her react.
Yes, her reacts. So then she was okay, but I don't know, like I'm saying, therapy is something new, but I think people are more fragile today
Yeah.
because in all this time, only with you have to think and like to be stronger, or maybe someone that speak stronger to you, and then you are okay again. I don't know.
Yeah, that's right. The crystal, uh, how is it called?
Niñas de
Um,
cristal.
yeah, it's more like that. It's something like that. I don't know if it's the complete, I don't know, the complete word or the very useful word to describe that kind of people, but I think we are more like we need help, we are bad, we are like a victims. I don't
Mm-hmm.
know what do you think, Salome.
Uh, I think I have two ways. In the first way, I think a therapy in disease is necessary because sometimes the condition of the patient is so deep that
Mhm.
we can understand only with talk, and maybe the therapy of the kind of therapy have a method to try to communicate with patients and try and maybe know what is happening and what pattern could be follow this patient. But for other way, sometimes recognize that you need help is a good symptom for say that you want to be better or you want to have better conditions for the life for your mind. I don't know, it depends of the disease, but for the other way sometimes just need time to how do you wait I mean uh, uh, time to get well your heart or your mind of the situation that you are happening. So, in my opinion, I think that all are humans. So, or maybe sometimes we will feel better, bad, or like confusing in some situations. So I think could be the therapy or only talk with a friend, but that friend or person that you trust have to listen to you and it have a good words to say it, and it does not only listen but like a humans maybe we will have little times to be bad, and that is normal, that is okay, and maybe we need help, but no it's necessary. I think therapy maybe only a good friend or a good person that we trust in them and talk to, because if you speak you will be better, but if you be quiet you will have this problem in your head and in your heart, and that is not good for our health.
Yeah, that's right. I think the same. I share with you both sides. So it was really good. Okay, we don't have enough time to talk more, but I will send to you my little questionnaire, please. I don't know if you can see it now.
Yes, I did.
Okay. Okay, so tomorrow, Carlita won't gonna make it again. She's taking care of herself, and I don't know who is going to go first.
Liz, do you want to be first?
Yes, it's
Okay.
okay for me.
Okay.
Carlita is okay.
She's okay, but she has problem with her eyes. Maybe she received an intervention, not a big intervention, but a little one, and her sight is not very much comfortable, so she has to rest just
Mm,
a few days, and the next class will be with us. So don't worry.
Okay.
I remember that she likes
Yeah.
the mental treatment. So,
Topics.
uh-huh.
Yeah, that's right. That would be interesting for her. Okay, so I will send to you two questionnaires, but or two practices, but they're not so long. Okay,
Mhm.
for tomorrow maybe at until 23:59, please.
Okay.
Okay, I will share with you by WhatsApp.
Okay.
Okay.
Okay, guys. Good to see you. Have a nice night.
Good night, teacher. Bye,
You
Liz. Good night.
too. Bye.